South Africa added close to 9,000 new COVID-19 cases in the last 24 hours. This brings the total number close to 206,000. Of those who tested positive for the coronavirus, almost 98,000 have recovered. Gauteng and the Eastern Cape account for more than 65% of new cases confirmed in the last day. The Health Department reported 111 further deaths, bringing the total since the outbreak to 3,310. Gauteng reported 50 deaths, the Western Cape 35, Limpopo 17 and the Eastern Cape 9. South Africa has conducted more than 1.8 million tests. Well, COVID-19 infections in Gauteng is approaching the 70,000 mark with more than 400 deaths. President Cyril Ramaphosa has asked the province to make more beds available as numbers rapidly increase. Our reporter Khayelihle Khumalo is following that story, joins us now from Parktown. Tell us what's going to be happening there today in light of this escalation of numbers.
Well, obviously, there's a great deal of concern from the side of the authorities, especially at the country's economic hub. So we're still just here at Charlotte Maxeke. So this is one of the facilities that was earmarked to treat COVID-19 patients. But obviously, the workers as well, the healthcare workers, will be honored today by the Health MEC, Dr. Bandile Masuku, given the very magnitude of the work that they are facing. But Jane, let's just talk to the Workers' Union and how, just to get their perspective in terms of how they are coping with the workload. So, Tsepo, thank you so much indeed for joining us, sir. So maybe, first of all, how are your members coping, especially in Gauteng?
Yeah, I must say that things are very bad. Workers are fearful. There's a lot of anxiety because workers are also getting infected in the process. As a union, last week we visited several hospitals where we interacted with our members and also donated some masks, visors, and vitamin tablets. And I must say that you have an institution where currently there are more than 200 employees who are infected, who've contracted COVID-19,
And also now, let us look at now this concern around the bed in Gauteng, in terms of the facilities. What are your members saying on the ground?
Yeah, the situation is getting worse. Even though there are still beds available, but members are indicating that very soon hospitals are going to run out of beds. So there won't be beds to admit patients who are infected by COVID-19, and that is a situation which government must attend to very quickly because once we get there, you'll find a situation where even patients who deserve hospitalization are turned away because there are no beds, and the country cannot afford that,
And maybe just before I let you go, so what would be your message to government in terms of making sure that more PPE are procured and other very key essential goods that are key for your members?
Yes, it's important that there should be prompt intervention, especially in instances where workers are reporting that the hospital is running out of masks, running out of surgical gloves, all those things, so that we don't run the risk of getting workers infected just because of the unavailability of PPEs in a particular environment. And it's important that our workers should be taken care of because the more patients visit these institutions, the more attention they deserve. And if you're getting health workers contracting COVID-19, it depletes the number of frontline workers who are available to render services. So it's important that government must take care of these healthcare workers and ensure that there are enough resources at its disposal to render services to the people that need those services.
All right, Tsepo, thank you so much indeed for your time. So, Jane, there you have it from Nehao, making a plea to government.
All right, thank you very much for that.